Hi, everyone, and welcome to Nurses Notes 101. This is Alexa. So, today we will be going over aortic aneurysms, aortic dissections, and aortic ruptures. As hopefully most of you know, an aortic aneurysm is a bulging out of part of the aorta. The aorta is a large artery that carries blood from the heart systemically to the rest of the body. Usually, when we have aortic aneurysms in patients, we see three different kinds. The most common that I've seen is abdominal, but we also have thoracic or in between thoraco-abdominal aortic aneurysms. We could also have an aortic aneurysm emergency, also known as an aortic dissection, which is when the aorta itself tears from its lining, versus an aortic rupture, which is just a leaking of the aorta itself. So, when these aneurysms dissect or rupture, it can allow blood to leak into the chest, causing for a cardiac emergency, which could potentially lead to death. Shown in the picture on the left is an aortic aneurysm. You can see the outpouching of the aortic artery. An aortic aneurysm is diagnosed most commonly through echo, but also through abdominal ultrasounds, which will show that bulging or outpouching of the aortic artery. An echo, while also used as a diagnostic tool for aortic aneurysm, it's better used to note severity of the aortic aneurysm itself. An ultrasound doesn't really show clear dimensions as well as an echocardiogram, and an echocardiogram can also tell us more about the heart, including cardiac functions. Signs and symptoms of aortic aneurysms include sharp, sudden pain in the back, which can radiate down to the lower body parts, along with shortness of breath and pain in the jaw. Causes of aortic aneurysm usually stems from high blood pressure. Another cause of an aneurysm can be sudden blunt injury, bacterial infections, and renal failure. Also, certain individuals with genetic abnormalities are more prone to aneurysms. So, these are two connective tissue disorders that people have seen. These patients are more likely to get aneurysms. So, those with Ehlers Danlos or Marfan syndrome. Like I said before, aortic dissections and aortic ruptures cause a leaking of blood into the chest cavity. This is a medical emergency. First and foremost, you would want to take the vital signs and see if they are hemodynamically stable and consult surgery. For symptom control, if the patient's hypotensive, let's say they're in pericardial tamponade, we want to watch out for critical hypotension. Say their MAP is under 65, they might need pressors, and at that point, they'll probably need blood as well. For the hypotensive patient, a lot of times physicians will opt to do a pericardiocentesis. So this is when they drain fluid from uh, the pericardial sac, and this will help promote cardiac output by decreasing the pressure on the heart itself. Along with these medications for hypotension and treatments for hypotension, if the patient's blood pressure is adequate enough, we will also give IV opioids to control pain because a lot of times these patients are in a ton of pain. Sometimes, when a patient has an aortic dissection, they can be in a hypertensive emergency and tachycardic, so with a high heart rate. For heart rate control, a lot of times we'll give a beta blocker such as labetalol, esmolol, metoprolol for a heart rate maintained under 60. And then for blood pressure control, the usual number one course of treatment is a calcium channel blocker, or we can use a vasodilator to keep the systolic blood pressure between 120 and 100 millimeters of mercury. Keeping the heart rate low and the blood pressure on the lower side of normal will prevent the aorta from further dissecting um, and further leaking out of blood. Also, they'll reverse the patient's coagulopathy. So sometimes they can give FFP, vitamin K, desmopressin to stop the patient from bleeding so much, to try and help the patient clot. Platelets can be given as well. This is the end of the discussion on aortic dissection and aortic aneurysms. Like and subscribe to my channel.